Good afternoon. We continue with part 2 of our series, Life After Blood Clot, Post-Pulmonary Embolism Syndrome. Beating pulmonary embolism in itself is a victory, but for about a third of the survivors, new struggles begin. Breathlessness, fatigue, fatigability, fear that the clot won't go away, or even that the clot has come back. This lasting impact is what we call post-PE syndrome, and sometimes it reveals a serious underlying condition called chronic thromboembolic pulmonary hypertension. So what are some of the common symptoms that occur months after treatment of PE? One of the commonest is shortness of breath even at rest. There is fatigue, there is reduced stamina, you may get chest discomfort or even palpitations. Some even have difficulty in concentrating, brain fog, and a few go to develop anxiety, depression, constant fear of another clot. Fear after pulmonary embolism is very common. Many survivors describe a feeling like they are living with a tickling time bomb. Every chest pain, every breathlessness or palpitation triggers panic that the clot is back. This fear is real and can deeply affect sleep, confidence, or even the quality of life. However, the good news is that with regular follow-up, with proper treatment, and even reassurance from your doctor, most survivors are healed completely and they do not develop another PE. Recently, I saw one of my patients. I had treated her and completed treatment for pulmonary embolism after surgery, and I discharged her from the clinic 3 months ago. She comes 2 weeks later, breathless, having palpitations with chest pain, convinced that the clot has recurred. After I examined her, everything was okay. We did dimer test just to be sure, and they were completely normal. And I just reassured her. She told me she had not been sleeping well, was anxious, and after a long discussion, showing her the tests were okay, we released her from the clinic. So this fear is real, but remember, regular follow-up, reassurance from the doctor, you can be cured completely from a PE. However, a few can get recurrent PEs, and we'll discuss that in post 13. So, who develops chronic thromboembolic pulmonary hypertension? Some clots do not clear completely, and they leave a scar tissue in the lung arteries. This blocks blood flow in the lungs, causing strain in the right side of the heart. The right side of the heart pumps blood to the lungs, and if the clot did not clear completely or left a scar tissue, it forces the right side of the heart to work excessively. This raises pressure in the lung arteries, what we call pulmonary hypertension. So you have high pressures in your lungs, pulmonary hypertension, and you also have strain on the right side. So you have right-sided heart failure. The medical term is called pulmonary. So when clots don't clear completely or they leave scar tissue, you develop pulmonary hypertension and right-sided heart failure. This chronic thromboembolic pulmonary hypertension develops in about 3 to 4% of PE survivors. It develops slowly and most times is mistaken for poor fitness or anxiety. And if untreated, it can lead to right-sided heart failure or even death. So what are the signs to watch out for? One is worsening breathlessness. If you see the breathlessness persists even after treatment, you may develop leg or abdominal swelling. Rarely you can get dizziness or even fainting on heavy activity. And if your oxygen is low, your lips or your fingers can turn blue. So those are danger signs: worsening breathlessness, leg or abdominal swelling, dizziness, fainting, blue lips or fingers. You are worried that you may be developing chronic thromboembolic pulmonary hypertension with right-sided heart failure, and you need to see your doctor urgently. So please see your doctor if you have any of those symptoms. There are a number of tests that we actually do to diagnose chronic thromboembolic pulmonary hypertension. Some simple ones include an echocardiogram. It can show us features of right-sided heart failure. You can do a CT pulmonary angiogram or even right heart catheterization. We also have a number of treatment options that your doctor may put you on if you develop chronic thromboembolic pulmonary hypertension. So see your doctor if you have any of those symptoms. We have pulmonary hypertension medications like bosentans that we can use. Patients, you may require to be put on blood thinners. There is what we call pulmonary rehabilitation, and also mental health support to ease anxiety and fears of recurrent. And other rare ones are surgical interventions like pulmonary endarterectomy. So please note, even for those who develop chronic thromboembolic pulmonary hypertension, don't stay with persistent breathlessness. Don't stay with persistent anxiety. Please see your doctor. Have a discussion with your doctor. Danger signs are sudden chest pain, breathlessness, fainting, coughing up blood or hemoptysis. You may have chronic thromboembolic pulmonary hypertension, and this is treatable. You may need to be on medications for quite some time, but the drugs are there. But also for the majority, it may just be post-PE syndrome, the anxiety. See your doctor for reassurance. So please note, surviving a clot is victory. With the right care, most people go to live a full, active life full of fear. If you are anxious, see your doctor. We can do basic tests and clots are treatable. But the most important thing is early diagnosis of pulmonary embolism. If you pick pulmonary embolism early and treat it correctly as discussed earlier, you are able to prevent some of these conditions. And if you are anxious, follow your doctor's advice. Keep up your appointment. Regularly follow up your doctor, check up to monitor. Medication adherence. Take your medications as prescribed. Take your medications to completion. Know your symptoms. Know the danger signs. If you get breathlessness, if your legs start swelling, see your doctor and see them soon. Stay active. Keep walking. When traveling, travel smart. Lifestyle changes. Maintain a healthy weight. Eat a balanced diet. Stay hydrated. And emotional recovery is key. Anxiety is common. Talking to a counselor or a support group. We have seen in this post many people have survived clots. If you have had one, post in the comments so that you can encourage others. So the bottom line, many people are completely cured after a clot and you can return to a normal life. The key is to follow your doctor's instructions, stay consistent with preventive measures, and listen to your body. Even if you are just anxious, see your doctor for reassurance, and you can live a normal life after a clot. And even if you develop the thromboembolic pulmonary hypertension, it is also treatable. See your doctor, maintain your regular follow-up. So if you have recovered from a clot, please share your story. You might encourage someone else. Stay tuned for tomorrow's post where we will discuss, can clots come back? The recurrence risks you must know. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.